Our presentation on evidence-based policy is heat health warning systems and their effects on heat exposure-related mortality and morbidity.
Extreme heat effects on health in urban heat islands. Extreme heat is causing more deaths in the United States than all other weather-related disasters combined. This problem is getting worse because of climate change and the urban heat island effect, which makes cities even hotter. The urban heat island effect is caused by the built environment and waste heat, which makes cities even warmer than their surroundings. In the past, extreme heat has caused many deaths, such as during the Chicago heat wave of 1995 and the European heat wave of 2003. Even more recently, the U.S. Pacific Northwest and Canada experienced a heat wave that caused many deaths. Climate change is responsible for more than a third of all heat-related deaths in the past 30 years. Extreme heat not only harms human health, but also damages infrastructure, ecosystems, and economies. Unfortunately, marginalized communities suffer the most from extreme heat because they have less access to infrastructure, vegetation, and resources that could help them cope. Some populations that are at an increased risk are communities of color, older adults, low-income communities, and children.
This causal framework conceptualizes and analyzes the relationship between the cause and effect under extreme heat exposure and the results from this cause. Some factors that can lead to heat stress could be a decrease in water consumption, an increase in alcohol consumption, the possibility of a pre-existing health condition, or as stated in the previous slide, an individual's age, whether you're a child or elderly, you can be affected by heat. Factors that can contribute to a heat illness, for example, a heat stroke, could be similar to the previous factors, such as drinking alcohol, dehydration, medication, wearing tight clothes, being overweight. When your body cannot regulate and cool down, you'll experience dizziness, a flushed appearance, delirium, and a more extreme outcome would be a seizure. Thus, heat stroke could lead to brain damage, organ failure, and worst case scenario, death. The evidence-based policy program we chose was Heat Health Warning System. The Heat Health Watch warning system was created to predict heat waves that could lead to a significant increase in mortality. This system was formulated after studying mortality and meteorological data in 14 cities through a retrospective analysis. Countries that this policy has been studied in is Greece, Hungary, Netherlands, North Macedonia, Portugal, Romania, Slovenia, and Sweden. Our rationale was extreme heat is an issue that is not widely discussed, and despite being completely redeemable, it continues to have high mortality rates. International rates have shown success in extreme heat mitigation. Therefore, the mortality rates in the United States remaining high show a lack of urgency to help those most impacted, for example, marginalized communities. An adoption of these international policies would potentially show an eradication of extreme heat deaths in the United States.
The first peer review article we discovered on heat health policy systems uses various methods to assess public awareness and practices during heat waves that were based on routine data collection from services such as phone calls to heat information lines. A more direct method is through public surveys conducted face-to-face, over the phone, or by post or email. Such surveys have shown that while knowledge of heat warnings is high, vulnerable groups such as the elderly are less educated and less likely to follow advice. However, awareness of heat alert through media is also associated with higher levels of change in practices and increased effort to support vulnerable individuals. Overall, these efforts have been shown to reduce mortality rates linked to extreme heat by 2.6%. The second peer-reviewed article on heat health systems involved a comprehensive review of existing literature on warning systems, along with a web search of the website of National Meteorological and Hydrological Services, conducted between January and May 2019. This analysis sought to establish index heat warnings and determine the threshold that should trigger the heat warning systems with the main objective of saving lives. The study serves as a needs assessment and a call to action for implementing an effective heat warning system. The article also highlighted the effectiveness of such policies in countries like Germany, where there has been a decrease in demand for ambulances for heat-related illnesses and fewer heat-related mortalities. In addition, the study reports that increased education on the subject has led to a perceived threat of danger which has emerged as a leading cause of behavioral change. The final peer-reviewed article on heat health systems conducted a long-term analysis from 2005 to 2015 on the impact of such systems on health in countries like Germany or overseas in Europe. The policy was targeted towards governmental authorities and federal state ministries as well as nursing homes with the aim of increasing awareness of the dangers of heat waves and their adverse health outcomes. The article also revealed that the cost of implementing heat warning systems is in USA dollars, $210,000, while the benefit of saving 717 lives amounts to US dollars, $468 million. In summary, policies such as heat health systems not only have the potential to save lives, but to generate substantial cost savings. Heat health warning systems are decision-made tools developed by a collaboration between epidemiologists and meteorologists. All heat health warning systems utilize impact-based forecasts, which determine when local temperatures and humidity conditions are likely to produce heat levels that are hazardous to human health and may cause heat-related illnesses or death. These conditions are classified as moderate, 3 to 5, high, 6 to 7, or very high, 8 to 10, and extreme, 11 plus. However, the moderate to very high labels do not produce detailed information beyond the fact that UV intensity is increasing. It should be noted that heat stroke can occur when the body's core temperature reaches 104 degrees Fahrenheit or 40 degrees Celsius or higher, and immediate medical attention is required to give preventative damage control to brain and other vital organs, which may result in death. So, as you can see by this chart, it's just a little chart on temperature and UV index, and it shows when is danger level, when is moderate, and when there's the lowest chance of heat-related injury or death.